Hello and welcome. I'm Dr. Misty Gibson, and I'm so glad that you've chosen to join me for this soft touch workshop, Fascia Informed Sex Therapy and Somatic Approaches for Clinicians. If we haven't met before, I'm a licensed clinical professional counselor, a licensed mental health counselor, and ASECT certified sex therapist. I specialize in working with adults who are neurodivergent, queer, non-monogamous, and or living with complex trauma, and I spend a lot of time helping both clients and clinicians untangle the very real connection between the body, shame, and sexuality. I also teach graduate counseling, supervised clinicians, and when I'm not talking about fascia and nervous systems, you'll probably find me recording my Untamed Ember podcast or writing about all the things I wish someone had told me sooner. Now, I want to acknowledge something right off the bat. If you're here watching this, you're probably already someone who gets that bodies matter in therapy. You might be working with clients who say things like, I know I should feel better, but my body just won't let me. Or, I understand why this happened, but I still can't relax during sex. Maybe you've noticed that your most brilliant therapeutic insights sometimes hit a wall when it comes to helping clients actually feel different in their bodies. If any of that sounds familiar, you're in exactly the right place. So let's start with the basics. What is SOFT and why should you care? SOFT stands for Somatic Oriented Fascia Therapy. It's a method I developed that brings together the science of fascia, our body's connective tissue web, with the wisdom of trauma-informed somatic practices, all with a focus on sexual health, intimacy, and authentic embodiment. You'll notice I use the word authentic a lot. That's because if you're here, you probably already know how often our clients, especially those living at the intersections of neurodivergence, queerness, and trauma, are taught to override their own bodies in order to fit in with someone else's idea of normal. Soft is about listening to the truth that lives in the body, especially when it comes to sexuality. But here's what makes SOFT different from other somatic approaches. While many trauma therapies focus primarily on the nervous system, which is absolutely important, SOFT specifically targets fascia as the primary site where trauma gets stored and where healing can happen. Think of fascia as your body's internal internet. It's this continuous web of connective tissue that wraps around every single muscle, every organ, every nerve. And when we experience trauma, especially the kind that impacts our sense of safety in our own skin, fascia responds by contracting, bracing, creating these protective patterns that can persist for years. Now, why does this matter for sex therapy specifically? Because so much of sexual wellness depends on our ability to be present in our bodies, to feel safe enough to be vulnerable, to literally soften and open. When fascia is locked up in protective patterns, which happens with sexual trauma, but also with things like chronic stress, medical trauma, or just living in a body that the world tells you is wrong somehow, it becomes really hard to access those states of relaxation and pleasure that intimacy requires. I developed SOFT because I kept seeing this gap in my clinical work. I'd have clients who had done years of excellent trauma therapy, who could articulate their triggers and their patterns, who understood intellectually why their bodies responded the way that they did. But when it came to actually being able to relax during sex or sleep through the night, or even just take a deep breath without their chest feeling tight, their bodies were still saying no, even when their minds were ready to say yes. Traditional talk therapy is brilliant for so many things, but it doesn't always reach the places where trauma lives in tissue. And while somatic approaches like sensory motor psychotherapy or somatic experiencing are fantastic for nervous system regulation, they don't specifically address how fascial restrictions can block our capacity for pleasure, intimacy, and embodied presence in the ways that sexual healing requires. SOFT bridges that gap. It gives us tools to work directly with fascial patterns while maintaining all the trauma-informed consent-based principles that good sex therapy demands. Now, what are we actually going to do in the next hour together? Here's what you can expect from this workshop. First, you'll get a brief practical overview of fascia and why it matters for trauma and sexual health. I'm not going to bog you down with anatomy you'll never use, but I will give you just enough science to understand why this approach works and how to explain it to your clients in language that makes sense. We'll explore how the SOFT method bridges traditional sex therapy and cutting-edge somatic work, and what makes this approach uniquely affirming and practical. You'll learn about the 4 stages of SOFT: sensing, opening, feeling, and transformation, and how they create a roadmap for fascial trauma healing that clients can actually follow. You'll learn a few foundational techniques, things you can actually start using with your clients right away, regardless of whether you're in person or on telehealth. We're talking practical tools here, not theoretical concepts that sound good but don't translate into real sessions. I'll walk you through some real-world case examples, plus specific tips for integrating SOFT in work with neurodivergent, trauma-affected, or otherwise marginalized clients. Because let's be honest, the techniques that work for privileged, neurotypical folks don't always land the same way for clients who have been pathologized or marginalized by healthcare systems. And throughout, I'll invite you to reflect, pause, and consider how this work lands for you, not just as a clinician, but as a human and a body. The more comfortable you get with your own embodied experience, the more skillfully you can guide others through theirs. So before we dive into the science, I want to give you a moment to check in with yourself. Take a deep breath, maybe close your eyes for a second if you want, and ask yourself, what brings you to this workshop? Maybe you're looking for new tools for those clients who seem stuck despite doing great therapeutic work. Maybe you're frustrated with how talk-only therapy falls short when it comes to bodies and sexuality. Maybe you've noticed that your own body tenses up when clients start talking about sex. And maybe you want to feel more grounded and present in those moments. Or maybe you just have this sense that there's something important about working with bodies that you haven't quite figured out how to access yet. Whatever it is, jot it down. You don't have to share it with anyone, but having that intention might shape how you engage with the next hour. And if nothing specific comes up, that's perfectly fine too. Sometimes we need to hear something before we know what questions to ask. All right, let's get curious together. We'll start by exploring why fascia is so much more than just anatomy trivia and what it has to do with healing, shame, trauma, and our relationship to pleasure. Because once you understand how fascia works, you'll never think about embodied healing the same way again. To really appreciate why SOFT works, you need to know a little something about fascia. Fascia is everywhere in our work, whether we notice it or not. And once you start seeing it, you can't unsee it. So what is fascia? Fascia is a thin, tough, elastic type of connective tissue that wraps, connects, and supports every muscle, bone, nerve, blood vessel, and organ in our body. Picture it like an intricate, 3-dimensional spider web, one that doesn't just hold everything in place, but it actually communicates, adapts, and responds to stress. Okay, this might be a little gross for a second. If you've ever cooked chicken and you notice that filmy, pearly layer between the skin and the meat, that's fascia. But here's what's wild. Fascia isn't just structural scaffolding. It's actually one continuous piece of tissue throughout your entire body. So that fascia around your ankle, it's connected to the fascia around your hip, which connects to your diaphragm, which connects to your neck. It's all one integrated system. This means that tension or restriction in one area can affect sensation and movement patterns in completely different parts of the body. For a long time, fascia was ignored in Western medicine. It was just the stuff surgeons cut through to get to the important bits. But newer science shows that fascia is absolutely central to how we experience sensation, movement, pain, and crucially for our purposes, emotion, and memory. The connective tissue web is loaded with sensory nerves, actually more densely packed with nerve endings than muscle tissue itself. And it's deeply involved in transmitting signals throughout the body. This is why when we talk about someone carrying stress in their shoulders or feeling anxiety in their gut, we're actually describing a fascial phenomenon. Fascia literally changes its texture, density, and responsiveness based on our emotional and physical experiences. And here's something that might surprise you. Fascia responds to emotional states in real time. When you feel threatened, your fascia immediately begins to contract and brace. When you feel safe and connected, it softens and becomes more supple. This happens whether we're conscious of it or not. Now, let's talk about trauma. When a person experiences something overwhelming, physically, emotionally, or relationally, their nervous system responds with fight, flight, freeze, or fawn. But what happens in the body, in the tissues? The answer? The fascia contracts, it thickens, or it becomes stuck, like a well-worn path in the forest. This is your body's way of keeping you safe. It's protective. Think of it like emotional armor that becomes physical armor. Your body literally wraps itself in protective layers. But here's the thing. Fascia has memory. It's like a biological hard drive that stores not just the experience of trauma, but the body's adaptive response to it. Over time, chronic tension, bracing, or numbness in the fascia can become the new normal. The body adapts to the presence of threat, even long after that actual danger has passed. For a lot of our clients, especially those who are neurodivergent, have a trauma history, or have lived with stigma or oppression, these body memories get woven into the fabric of fascia. Their stories aren't just in their minds, they're literally written into their tissues. And this is why sometimes brilliant cognitive work hits a wall, because the body is still holding on to patterns that served them once, but may not serve them anymore. This is particularly true for sexual trauma, but also for the subtler forms of body-based oppression that many of our marginalized clients experience. When the world tells you your body is wrong, too much, not enough, or dangerous, your fascia adapts to help you survive that reality. Okay, but what does any of this have to do with sex therapy? Here's where it gets interesting. The same fascia that wraps around your muscles and joints also surrounds your pelvic floor, your genitals, and every organ involved in sexual arousal and intimacy. That means that unresolved tension, shutdown, or chronic numbness in fascia can show up as what we might traditionally call sexual problems. This might look like pain during sex because fascial restrictions can create actual physical limitations. It might look like difficulty feeling aroused because when fascia is braced in protection mode, it literally blocks sensation. Or it might show up as just a sense of being disconnected from one's own pleasure because the body has learned that feeling good isn't safe. But here's what's really fascinating. Because fascia is one continuous system, sexual challenges might not even originate in the genitals or the pelvis. I've worked with clients whose sexual shutdown was directly connected to tension that they held in their jaw from years of not being allowed to speak up, or in their chest from learning to breathe shallowly to avoid taking up too much space. Research is starting to catch up to what many somatic practitioners have known for years. When we work with the body with fascia, not just around it, we can unlock trauma, support nervous system regulation, and make space for pleasure, connection, and authentic consent. And that's not just theoretical, it's measurable. Studies are showing that fascial release work can improve sexual function, reduce chronic pain, and increase overall embodied well-being. This is where soft becomes such a powerful addition to your toolkit. Instead of just talking about the body or even just working with nervous system regulation, we're addressing the actual tissue-level patterns that might be blocking your client's capacity for intimacy and pleasure. So let me give you an example. A client I'll call John Late 30s, neurodivergent, queer, long history of relational trauma came to me because he'd lost all interest in sex. It's like my body just shuts down, he said. My mind is there. I want to connect with my partner. But the second things get intimate, I go numb or tense up. I can't even tell if I want to have sex or not. Now, John has done years of excellent trauma therapy. He could articulate his triggers, understand his patterns, and he had a great insight into how his childhood affected his relationships. But his body was still saying no, even when his mind was ready to say maybe. In our work together, we discovered that John's body, specifically his hips, chest, and throat, would tense up the moment any sort of erotic touch was initiated. When we mapped this together using soft techniques, John realized these weren't just sexual sensations. They were the same shutdown response he'd developed to survive years of criticism and rejection. His fascia was still protecting him from vulnerability, even in the context of a loving relationship. By integrating fascia-informed touch and mindful body awareness, John started to notice shifts, less numbness, more choice in how his body responded, and eventually a return of curiosity and pleasure. Not because we fixed his trauma, but because we gave his body new options for how to respond to intimacy. So, as you think about your own clients, I want you to consider, where do they most often report tension, numbness, or shutdown around sexuality? Is it their jaw, their chest, their pelvic floor? Do they get a lump in their throat when they try to set a boundary, or do their legs feel heavy when sex is even mentioned? Maybe they describe feeling checked out from their neck down, or like their body belongs to someone else during intimate moments. These patterns often show up in other areas of their lives too. The client who can't orgasm might also have trouble sleeping deeply. The person who experiences pain during penetration might also hold their breath during conflict. The individual who feels numb during sex might also struggle to feel excitement about anything. Take a moment to jot down some patterns you've noticed. Or if you're feeling brave, check in with your own body right now. Where do you tend to hold tension when conversations turn to sexuality, shame, or intimacy? Do your shoulders creep up towards your ears? Does your breathing get shallow? Do you notice yourself crossing your arms or shifting in your chair? There's no judgment here, just curiosity. The more aware we become of our own embodied responses, the more skillfully we can guide our clients through theirs. All right, keep those notes handy. The patterns you notice here will become important as we move into the next section, where I'll walk you through the SOFT method itself, the 4 stages that create a roadmap for fascial trauma healing that your clients can actually follow. We'll break down sensing, opening, feeling, and transformation, and I'll give you some practical tools you can start using right away. Now that we've laid the groundwork for how fascia, trauma, and sexual health are deeply linked, let's get into what makes the SOFT method unique, and most importantly, how you can start to use these tools in your own practice. This is where we move from theory into practical application that you can literally start using tomorrow. First, let me remind you, SOFT stands for Somatic Oriented Fascia Therapy. At its core, SOFT is built on 3 foundational principles. Trauma-informed, that means we recognize that everybody's body carries a story. We assume that even when someone's words are saying yes, their body might still be saying no. And that's not resistance, that's wisdom. We don't try to override the body's protective responses, we work with them. This means we go slow, we check in frequently, and we trust that the body knows what it needs, even when the mind hasn't caught up yet. In practice, this looks like normalizing when clients say things like, "I know I should want this, but my body just shuts down." Instead of treating that as a problem to solve, we treat it as important information. The body's no is often protecting something precious, maybe an old wound, maybe a cultural message they've internalized, maybe just a nervous system that's learned to brace against vulnerability. The next is consent-centered. In soft, consent isn't a checkbox you tick at the beginning of a session. It's a moment-by-moment embodied experience. We honor not just the client's verbal yes or no, but also their breath, muscles, and even micro movements are telling us in the room. This means teaching clients and ourselves to notice the difference between intellectual consent and embodied consent. You know that feeling when someone asks if you want to do something and your mouth says sure, but your whole body contracts? That's the difference. In soft, we're constantly tracking, does this feel like a yes in the body or just in the head? And we normalize changing our minds, slowing down, or saying not today without having to justify it. And the third is nervous system regulation focused. We understand that dysregulation, fight, flight, freeze, fawn, can show up as what we might traditionally call sexual dysfunction or relationship barriers. When someone's nervous system is stuck in protection mode, their body literally can't access states of pleasure, curiosity, or authentic connection. Soft techniques aim to bring the nervous system back to a place of safety and choice, which then creates the conditions where intimacy becomes possible again. This doesn't mean that we're trying to eliminate all activation or make everyone calm all the time. It means we're helping clients expand their window of tolerance, the range of intensity they can experience while still feeling like themselves. Soft is not just another body-based practice. What makes it unique is how it integrates somatic work and sex therapy. Many somatic approaches give us beautiful tools for working with trauma or stress, but they often sidestep sexuality, either because practitioners aren't trained in sexual health or because there's still this cultural discomfort with addressing pleasure and intimacy directly. You'll get amazing nervous system regulation tools, but when it comes to actual sexual healing, you're kind of on your own. On the other hand, a lot of sex therapy models stick to the cognitive and behavioral realm. They're brilliant at helping people understand their sexual patterns, work through relationship dynamics, or learn specific techniques. But they often miss what's actually happening in the body, the way fascial restrictions might be blocking arousal, or how stored trauma in the pelvis might be creating pain that no amount of cognitive work can touch. Soft is designed to bridge that gap. We use fascia-informed interventions that work directly with the body's connective tissue, helping clients notice, name, and shift what's happening inside before we start analyzing or problem solving. It's like giving the body a voice in the conversation about sexuality instead of just talking about the body like it's not in the room. This integration is especially crucial for marginalized clients, folks who are neurodivergent, queer, survivors of trauma, or anyone whose sexuality has been pathologized or shamed. Because for these clients, healing often requires not just changing thoughts or behaviors, but literally reclaiming their relationship with their own embodied experience. So, now that you understand what makes soft unique as a bridge between somatic work and sex therapy, let me show you exactly how this framework operates in practice. Think of these 4 stages not as a rigid linear process, but as a cycle that clients move through organically, sometimes shifting back to earlier stages as deeper layers of healing emerge. Sensing is where we always begin. It's about cultivating basic body awareness and establishing safety. In this stage, we're helping clients develop what's called interoceptive awareness, the ability to notice what's happening inside their body without trying to change anything. For many trauma survivors, especially those with sexual trauma, the body has learned to go offline as protection. So in the sensing stage, we start gently. What do you notice in your chest right now? Or can you feel your feet on the ground? We're rebuilding that fundamental communication pathway between conscious awareness and embodied experience. This stage is crucial because you can't heal what you can't feel. Without basic body awareness, all the other interventions in the world won't create lasting change. Once someone can sense what's happening in their body, we move into opening, the gentle unwinding of fascial restrictions. This is where we introduce the trauma-informed release techniques I'll show you soon. Opening isn't about forcing or pushing through tension. It's about creating enough safety that the body can begin to soften protective patterns on its own timeline. We might use self-myofascial release with gentle tools, breathing techniques, or micro movements that honor the body's pace. In this stage, clients often say things like, "I didn't realize how tight my chest was until it started to relax," or "My hips feel like they're finally letting go of something they've been holding on to." As fascial restrictions begin to soften, we enter the feeling stage, and this is where things get really interesting. When fascia releases, it often brings up the emotional content that was stored there. This might be memories, it might be sensations, emotions, or just a sense of something shifting. In traditional therapy, we might try to process emotions cognitively, but in soft, we stay with the embodied experience first. We might ask, if this sensation in your belly had a voice, what would it say? Or, what does this feeling in your chest want you to know? This stage requires careful titration because we don't want to flood the nervous system, but we do want to honor whatever wants to emerge. It's about feeling with the body, not just thinking about feelings. Finally, we reach transformation, the integration phase where new patterns of safety, agency, and pleasure are consolidated and anchored. This is where clients expand their window of tolerance and develop capacity for the vulnerability that intimacy requires. In this stage, we're not just processing what was, we're embodying what's possible. Clients might practice receiving touch without bracing, setting boundaries from a place of self-care rather than fear, or simply allowing themselves to feel pleasure without shame or hypervigilance. Transformation is about the body learning new responses. Oh, I can say no and still be loved. Or I can feel aroused and stay present in my body. Or I can rest without waiting for the other shoe to drop. Here's what makes this framework so powerful. These stages aren't a one and done process. They're cyclical. A client might move from sensing to opening, then back to sensing when they encounter a new layer of protection. Or they might experience transformation in one area of their body while still working on basic sensing in another. This cyclical nature is actually healing in itself. It teaches clients that growth isn't linear, that setbacks are just information, and that their body's wisdom can be trusted to guide the process. The beauty of having this roadmap is that both you and your clients always know where you are and what the next step might be. When someone feels stuck, you can ask, are we in a sensing moment right now? Do we need to slow down and just notice what's happening? Or when they're ready for more, I'm wondering if your body is ready to explore some gentle opening. This framework gives you a way to track progress that honors the body's non-linear healing process while still providing clear direction for your clinical work. Let's talk about a few foundational soft techniques that you can start to play with either for yourself or with clients. These are simple enough to introduce into any session, but powerful enough to create real shifts. The first I'd like to share with you is micro boundary moves. This is the art of making the smallest possible shift in the body to honor a boundary. Think of it as giving your nervous system permission to say, that's enough, or slow down, without having to make a big announcement about it. For example, instead of pushing through tension in your chest when someone moves closer, you might subtly lean back or place a hand on your heart. It's about giving the body permission to say, enough, or wait, in a way that's almost invisible to others but profoundly felt by you. For clients, this might look like wiggling their toes when they feel overwhelmed, uncrossing their legs when they want to feel more open, or even adjusting their posture to feel more grounded. The key is that it's their choice, their timing, and their body wisdom leading the way. I love micro boundary moves because they teach clients that they don't just have to wait for permission to take care of themselves. They can honor their body's needs in real time, which is essential for building trust between mind and body. The next exercise is body check-ins. At its simplest, this is pausing to ask, "Body, what do you need right now?" And then actually listening. This might sound simplistic, but for folks with trauma or shame scripts, even noticing that their jaw is clenched or their stomach is in knots can be a revolutionary act. In SOFT, we often use body scans, gentle movement, or even playful naming of sensation to help clients build trust with their own inner cues. Instead of just asking, "How are you feeling?" we might ask, "What's your chest telling you right now?" Or, "If your hips could talk, what would they say?" The goal isn't to immediately fix or change anything. It's to rebuild the communication pathway between conscious awareness and embodied experience. For many clients, this is the first step towards being able to feel genuine desire, set authentic boundaries, or recognize their own pleasure. Another exercise I love, fascia awareness mapping. This is a more structured technique where you invite the client to map out areas that feel alive, numb, tight, or open as you talk about different aspects of sexuality or intimacy. You can choose colors, scribbles, or just words on a simple body outline. The point is not to fix anything, but to see the landscape and acknowledge what's true in the body right now. This technique is incredibly helpful for clients who struggle with body awareness or who feel disconnected from their physical experience. It also helps you, as the practitioner, understand how trauma or shame might be showing up somatically, which can guide your treatment planning. For example, a client might notice that their pelvis feels gray or shut down, but their heart feels buzzy or warm or yellow. That gives us information about where to focus our work and how to pace interventions. Let's try a brief, self-guided exercise together so you can experience what this feels like from the inside. If you're able, sit comfortably and close your eyes or soften your gaze. Take a deep breath in and slowly let it out. And let your body settle into whatever position feels most supportive to you right now. And when you're ready, just scan your body from the top of your head down to your toes. Just a quick check-in, every body part. Notice if there's any area that feels tense, guarded, or a little bit checked out. Don't try to change anything yet. You're just noticing. And pick one area, maybe this is your jaw or your shoulders, with as little movement as possible. Make a micro adjustment. That might mean unclenching your jaw, shifting your weight in your seat, rolling your shoulders, or even just pressing your feet more firmly into the ground. The key word here is micro. We're talking about the smallest possible movement that brings relief or ease. Pause and notice. Does this small boundary shift bring a change in sensation, breath, or even emotion? Maybe your breathing deepens or your body feels more settled. If you feel comfortable, place a hand on that area that feels most activated or most at ease and just breathe there for a few moments, just a few breaths. Let your body know that it's allowed to change its mind, to say enough or not yet, even if it's just a tiny signal. And now gently bring your attention back to the present. Maybe wiggle your fingers and toes. Take another breath, and when you're ready, open your eyes, focus in again, and take a moment to jot down what you noticed, or if anything surprised you. Did your body respond differently than you expected? Did the micro movement create more change than you anticipated? Now let's think about practical application. Take a moment and ask yourself, how might you introduce this kind of micro boundary move or body check into your clients? Would you use different language? Would you demo it yourself first? How could you adapt this for someone who's neurodivergent and might need more concrete instructions, or for someone who feels a lot of shame about their body and they might need extra time or permission to tune in? Maybe you're thinking about a specific client right now, someone who gets overwhelmed in sessions or who struggles with boundaries or who seems disconnected from their physical experience. How could you introduce these concepts in a way that feels safe and accessible for them? Jot down any phrases or adaptations that feel authentic to you. Remember, soft is not about perfection. It's about creating safety for experimentation and choice. First for yourself, and then for your clients. These foundational techniques are just the beginning. Now that you've experienced a taste of soft's foundational practices, let's talk about how you can bring these tools into your actual clinical sex therapy work, especially with neurodivergent, trauma-affected, and otherwise marginalized clients. This is where the rubber meets the road and where a lot of practitioners feel both excited and a little nervous. First, let's name the obvious. Most sex therapy training programs don't teach us what to do when a client's body is the one shouting no, even if their words are saying yes. We learn great cognitive and behavioral interventions, but when someone sits in our office and says, "I know I should want sex, but my body just shuts down," we often find ourselves trying to think our way out of a body problem. Soft invites you to bring the body into the room, not just as a theory or something we talk about, but as an active collaborator in healing. One simple way to integrate soft: start sessions with a body check-in. Instead of the standard, "How are you?" try something like, "What are you noticing in your body as we sit together today?" Or, "What are you noticing in your body as we talk about this?" If that feels too direct for you or your client, you might ease in with, "Would it be okay to slow down and check in with your body for a moment?" You can also weave body awareness into existing interventions. If you're doing sensate focus, instead of just asking, "What did you notice?" you might ask, "What did your body tell you during that exercise?" If you're exploring a sexual concern, you could say, "As we talk about this, I'm curious what's happening in your chest, your belly, or your shoulders." Here's what I love about this approach. You don't have to be a yoga teacher or a massage therapist to make this work. In fact, the less expert you feel, the more curious and non-judgmental you'll sound. And often, that's exactly what clients need most. You're not diagnosing their body or trying to fix it. You're just inviting it into the conversation. The key is starting small and following the client's lead. Some people will light up at the invitation to tune into their body. Others will need weeks or months to trust that it's safe. Both responses are perfect. So, for many neurodivergent or trauma-affected folks, especially those who are queer, trans, BIPOC, kinky, or non-monogamous, body-based work can feel extra loaded. Shame, dissociation, past living experiences of not having their boundaries respected can make embodied interventions feel risky, weird, or even triggering. These are clients whose bodies have often been pathologized, criticized, or violated. They may have learned to disconnect from physical sensation as a survival strategy, or they might have sensory processing differences that make traditional body awareness exercises overwhelming or inaccessible. Soft's answer is to move at the client's pace, to ask permission every step of the way, and to expect that the right answer for their body might be no, not now, or I don't know. You might say something like, "If at any point your body wants to do something different, shift positions, take a break, stop talking about this, you don't have to explain or apologize. I trust your body's wisdom, even if your mind hasn't caught up yet." For neurodivergent clients specifically, you might normalize sensory differences or shutdowns. A lot of folks with ADHD or autism notice their body goes offline in certain situations or when they're processing a lot of information. With trauma survivors, You might acknowledge the body's protective responses. Your body learned to shut down or brace as a way to keep you safe. We're not trying to override that wisdom. We're just getting curious about what it might need right now. For marginalized clients, it's crucial to acknowledge how systems of oppression literally live in the body. You might say, when the world tells you that your body is wrong or dangerous, of course it learns to armor up. That's not pathology, that's adaptation. The goal isn't to make everyone comfortable with body awareness. It's to create enough safety that clients can start to experiment with their own embodied experience at their own pace. Shame is slippery. It hides in the muscles, the breath, even the fidgeting we do in the therapy chair. Traditional approaches often try to cognitive behavioral therapy shame out of existence, but shame lives in the body, so that's where we need to meet it. With soft, you can bring shame out into the open, not by interrogating it, but by getting curious. What does that shame feel like in your body? Is it heavy, tight, prickly, cold? Does it have a shape or a color? Sometimes just naming it. My chest feels like it's wearing a weighted vest. Or there's this knot in my stomach. That can be enough to break the spell. Other times, the invitation is to try a micro-boundary move. Is there anything your body wants to do right now to feel just a little safer or more comfortable? Maybe they want to cross their arms or put their feet flat on the floor or hold a pillow. Consent becomes more than a signature on a form. It's allowing the client's body to say yes or no in real time and reminding them that no is always a complete sentence. One phrase I love, your body doesn't owe me or anyone an explanation. We can slow down or stop anytime, and that's not failure, that's good boundaries. This is especially powerful for clients whose sexual concerns involve difficulty with consent or boundaries. Instead of just talking about saying no, they get to practice it in session with low-stakes choices. Let me share a quick scenario to show you what this looks like in practice. A client I'll call Alex comes in reporting that whenever their partner initiates sex, they freeze. Not because they don't trust their partner, but because their body just checks out. They feel disconnected, numb, like they're watching their body from the outside. In traditional sex therapy, we might explore their thoughts during these moments, work on communication skills, or talk about trauma history. All important stuff. But instead of jumping straight into cognitive work, I invited Alex to map where in their body they feel most offline during those moments. Alex noticed that their hands go numb and their throat feels tight, like they can't breathe or speak. I asked, "What does your body want to do right now as you tell me this?" Alex said, "I want to put my hands over my heart." So I invited them to try this, just for a moment. I asked what they notice. Sometimes it's nothing. Sometimes there are tears, memories, or just a sense of relief. Over several sessions, Alex became more attuned to these early cues, the moments their hands started to tingle or their throat began to close. They started practicing micro-boundary moves with their partner, noticing when to pause, ask for a different kind of touch, or redirect the interaction entirely. What matters isn't fixing the freeze response, but supporting Alex in honoring the wisdom of their body and bringing their consent online in real time. The beautiful thing is that as Alex learned to trust their body's no, they also started to recognize their body's authentic yes, which had been buried under years of pushing through numbness. Okay, but Dr. Misty, what if I'm working virtually? Good news. Soft is just as effective over telehealth. In fact, working remotely can sometimes increase a client's sense of agency. They're literally in their own space and can adjust their body, stand up, or grab a weighted blanket whenever they need. On video, you can say things like, "Would you like to stand up or move around as we talk?" There's no rule that says you have to sit perfectly still. Encourage clients to have fidget toys, pillows, or sensory tools within reach during sessions. And model body awareness for yourself. This normalizes the fact that bodies are always communicating, even through screens. You can also use the limitations of telehealth as an advantage. I can't see your whole body, so I'm really going to need you to be the expert on what's happening in your own system. Take a moment now and jot down, what do you anticipate might be challenging about bringing soft practices into your work? Maybe you're worried about your own comfort with body-based interventions. Like, what if you suggest a body check-in and then you realize you're holding your breath? Maybe you're concerned about your client's willingness to engage or how this will fit into a 50-minute session that's already feeling packed. Maybe you're thinking about cultural considerations. How do you honor different cultural relationships to touch, body awareness, or emotional expression? Or accessibility concerns. What about clients with chronic pain, mobility differences, or sensory processing challenges? Maybe you're worried about scope of practice issues or how to explain this work to colleagues or supervisors who might not understand. Write down anything that comes up for you. Resistance, excitement, questions, concerns. It's totally okay to have mixed feelings about integrating new approaches, especially ones that feel more vulnerable or embodied than what you're used to. Remember, the goal here isn't to have all the answers right now or to become a perfect body-aware practitioner overnight. The goal is to start building your own curiosity and comfort with bringing the body into the room as an ally in healing. In our final segment, we'll pull together some practical tools for getting started, ways to introduce soft concepts with new clients, and how to keep building your own confidence as a fascia-informed sex therapist. We'll also talk about next steps, how to continue learning, where to get supervision, and how to take care of your own nervous system as you do this work. Now that you're getting a feel for how soft looks and feels in practice, let's get even more specific. How do you actually introduce this work in session? How do you get buy-in from clients, create safety, and adapt for the many different identities and bodies? Start with psychoeducation. I often begin by saying something like, our bodies store memories, emotions, and stress in ways we sometimes aren't even aware of, especially when it comes to sexuality and relationships. There's actually a whole network of connective tissue called fascia that can hold onto protective patterns long after we've processed things. Soft is a way for us to gently check in with your body and see what it might want to tell us about pleasure, boundaries, or even shut down. You might also explain why this matters. Sometimes our minds are ready for intimacy or healing, but our bodies are still saying, not safe yet. By tuning into what's happening in your tissue, your fascia, we can start to bridge that gap. Normalize the experience. This step is crucial, especially for clients who've never done body-based work. Remind them there's no right or wrong way for your body to respond. Many people notice tension, numbness, tingling, warmth, or even nothing at all. Every experience is completely valid. Sometimes the most important information is, I don't feel anything, because that tells us something too. You might also normalize resistance. If part of you feels skeptical or silly about this, that's totally okay. Your body has learned to protect itself, and that includes being cautious about new approaches. We'll go slow. Get explicit consent. Always get permission and make it ongoing. Would it be okay if we tried a very gentle body awareness exercise? This would just involve noticing sensations, no touching, no movement. If at any point you want to pause, stop, or do something different, just let me know. Your body leads here, not me. I also like to give them an out before we even start. And if this doesn't feel right for you today, we can absolutely stick with talking. There's no pressure to engage with body work if it doesn't feel safe or interesting. Offer a simple practice. Start with something really low stakes. Try a short body check-in, a micro boundary move, or even just a guided pause to notice breath and sensation. Use language that feels right for your client and their identity. Always circle back. What did you notice? Was anything surprising or did it feel familiar? There's no pressure to have a profound answer. Sometimes it takes a while to tune into these signals. If they had a big response, help them integrate. That sounds like important information your body just shared. How does it feel to have noticed that? If they didn't notice much, normalize that too. Sometimes our bodies need time to trust that it's safe to share information. That's totally fine. Clients can sense when you're being real versus when you're performing therapist expertise. If you're newer to body-based work, let them know. I'm learning how powerful these approaches can be, and I'm excited to explore this with you. We'll take this slow and go at your pace. This actually creates more safety than pretending you're an expert. It puts you in a learning stance together, which reduces the power differential and makes experimentation feel safer. Affirm autonomy constantly. Your body's cues are always right, even if they don't make logical sense right now. If anything feels off or just not for you, that's completely valid information. You're the expert on your own body. I'm just here to help you tune in to what it's already telling you. There's no goal here except noticing. Your body doesn't have to do anything, feel anything, or change anything to be doing this right. Anchor in safety first. Before doing any body work, invite clients to identify a safe sensation or movement. A deep breath, a hand on their heart, pressing their feet into the ground, or wiggling their toes. These anchors can help ground them if big feelings or memories arise. Try to say something like this. Let's find something that feels neutral or comfortable in your body right now. This will be your home base. You can always come back to this if anything feels like too much. Go at the client's speed, not your speed. Some people will be ready to dive into body awareness. Others need weeks or months before it feels safe. Respect that pacing without pushing or interpreting it as resistance. Say something like, "We have all the time in the world. Your body will let us know when it's ready for more." Remember, micro moves count. A client who shifts slightly in their chair or takes one deeper breath is doing body work. Don't underestimate the power of tiny changes. Check for overwhelm and offer regulation. Watch for signs that someone's window of tolerance is getting stretched. Rapid breathing, dissociation, or shutdown. Have regulation tools ready. Say something like, "Let's pause here. Can you feel your feet on the floor? Can you look around the room and name 3 things you can see?" Or, "It seems like a lot just came up. Do you want to slow down, or is there something your body wants to do right now to feel more settled?" Acknowledge and accommodate sensory sensitivities and unique processing needs. Be explicit about modifications. Some folks find it easier to do body awareness with their eyes open or while moving or with music. We can adapt anything to work for your brain. Normalize different responses. Say something like, "Neurodivergent folks often have really interesting and unique body awareness. There's no neurotypical standard you need to meet." Be explicit about body diversity, consent, and the impact of oppression. Our bodies carry not just our own personal history, but also the messages we've absorbed from society about bodies like ours. There's no one right way to feel or respond. Acknowledge systemic impacts. Say something like, "If you're someone whose body has been criticized, pathologized, or discriminated against, it makes complete sense that body work might feel complicated or risky." Center their expertise. Say something like, "You know what it's like to live in your body in this world. I'm here to support you, not to tell you what your experience should be." Emphasize choice and control at every single step. Say something like, "You're in complete charge here. We can stop, slow down, or change direction at any moment without explanation." Offer multiple opt-outs and alternatives. If tuning into your body doesn't feel safe today, we could talk about it instead, or focus on external anchors like sounds in the room. Normalize protective responses. You can say something like this: "If your body goes numb, tenses up, or checks out, that's not a problem to fix. That's information about how your body learned to keep you safe." For clients with chronic pain or disabilities, you can say something like, your body's experience is valid exactly as it is, and we're not trying to fix or change anything. Just get curious about what's there. Adapt techniques for accessibility. You can say something like this. If sitting still is uncomfortable, we can do this while you're moving. If lying down works better, that's perfect too. If you're interested in deeper soft training, visit Somatic Oriented Fascia Therapy.com for information about our multi-level certification program. We offer everything from public workshops to advanced clinical training. And thank you for your openness and willingness to try something new. Your clients are lucky to have practitioners who are committed to understanding the whole person, mind, body, and everything in between. Because let's be honest, bringing the body into therapy can be both exciting and intimidating, even for seasoned clinicians. And that's exactly where growth happens. You don't have to be a body expert to start incorporating these principles. You don't need to completely overhaul your practice. You just need curiosity, consent, and a willingness to slow down enough to let the body into the conversation. Start small and with yourself. Before you bring body awareness to clients, spend some time noticing your own embodied responses during sessions. Do you hold your breath when clients talk about sex? Do your shoulders tense when someone describes trauma? This isn't about becoming perfect. It's about building your own comfort with embodied awareness. Practice consent with yourself first. Notice when you push through fatigue, ignore your body's signals, or override your own boundaries. The more you can honor your own nervous system needs, the more skillfully you can guide clients in honoring theirs. Expect resistance, both from clients and from yourself. Our culture doesn't teach us to trust our bodies, especially when it comes to sexuality. Build your support network. This work brings up our own stuff. Make sure you have supervision, consultation, or peer support from practitioners who understand both trauma and sexuality. Don't try to figure this out in isolation. Remember that small changes create big shifts. A client who learns to notice their breathing, set one micro boundary, or identify one area of comfort in their body has made profound progress, even if it doesn't look dramatic. If today piqued your curiosity or raised more questions than it answered, good. That's what learning in this field is all about. You can dive deeper into soft and fascia-informed sex therapy in several ways. Visit my website at somaticorientedfasciatherapy.com, where you'll find blog posts, updates, a podcast, links to future workshops, and detailed information about the full soft practitioner training program. Check out the Untamed Ember podcast, where I share more on sex, shame, trauma, neurodivergence, and body-based healing. You'll find mini practices you can use right away and deeper dives into topics we only touched on today. It's available wherever you get your podcasts. And for some great free resources every single week to your inbox, join my newsletter for ongoing support and resources. Downloadable resources and regular tips for integrating embodied approaches. Consider the full soft certification program. We offer everything from introductory workshops to advanced clinical training to teacher certification. The program is designed to be accessible across different learning styles, practice settings, and professional backgrounds. Finally, I'd love to hear from you. Your feedback isn't just welcome, it's what helps me grow this program and make it more useful, accessible, and inclusive for our diverse community of practitioners. What resonated? What felt challenging? What would you like to see in future trainings? Your input directly shapes how I develop and refine these educational offerings. If you're interested in more advanced soft training, collaborating on research or projects, or if you have a tricky client scenario you want to talk through, please reach out. I genuinely love connecting with fellow therapists who want to do this work differently and who are committed to centering client autonomy, cultural humility, and embodied healing. You can find me at hello@untamedember.com or through any of the platforms that I mentioned. I try to respond to emails personally, and I'm always interested in hearing how practitioners are adapting and using these approaches in their own contexts. So, thank you for your courage, your openness, and your commitment to bringing the body, your own and your clients, into the healing process. Thank you for being practitioners who understand that sexuality and embodiment can't be separated, and that true healing happens when we honor the wisdom of the whole person. Let's keep challenging shame, centering consent, and building a world where all bodies, neurodivergent bodies, queer bodies, disabled bodies, traumatized bodies, bodies of all sizes and colors and abilities are welcome in healing spaces. Take a moment now to jot down one thing you're taking with you from this workshop. Maybe it's a specific technique you want to try, a shift in how you think about embodied consent, or just permission to slow down and listen to your own body more carefully. Whatever you're taking with you, trust that you have what you need. Your clients don't need you to be perfect at this work. They need you to be present, curious, and willing to learn alongside them. I hope our paths cross again soon, and I look forward to hearing how you integrate these approaches into your own practice. Take care of yourselves, and remember, your body has wisdom too.